Okay, so where we are in these coaching calls is module 3, and I've been going through each of the fascial lines. And today we're working on the deep front line, which is our final of the 5 full body lines. So we started with superficial back line, superficial front line, lateral lines, spiral lines, and now we're on the deep front lines. Okay, and we just have 5 full body lines. So after this, then we'll be looking at the functional lines and the arm lines. And then that is all the lines. So, so whether or not you've been through the rest of the lessons, I think you'll find it interesting. I'll probably use a couple terms that you might not be familiar with and might talk about the nervous system in a way that you're not familiar with. Don't worry, you'll learn all of that in module 2 or module 1. I talk a lot about organization and activation, so I'll take a minute to explain what that is and have you try it out. But otherwise, I'm not talking about anything so new that you won't have all the material in the course to help you understand it. Okay, so let's dive in. Okay, so as you probably, you may or may not know, we've kind of come up with a shorthand name for all of these fascial lines. They are kind of a mouthful, and it's good to kind of connect each line with something that's, its main function or, the main thing that you should know about this line. So we've called it the myofascial core of the body. So that's what our deep front line is. It's the myofascial core. And when you see a word like myofascial, that's basically myo, which refers to muscle, and fascia, of course, refers to fascia. So it's the muscles and fascia of the center of the body, our core support for the body. And it's not just in what we consider the core, like the core canister. It's from the feet to the head. Okay, this is a full body line, and it's quite different than the other lines, to be honest, because the other lines, it's a very longitudinal pathway to follow. Even the spiral line, which spirals, everything is sort of connected longitudinally, if that makes sense, sort of like a ribbon would be. Whereas the deep front line is more a series of arches and slings and domes, and is quite different. So we're looking at all of these structures that support the body from the inside out. And you're going to see that it's not just the spine, or the pelvis that supports the body. It's all of these fascial and muscular structures as well. Okay, so that's what it is, and it's lying in the center of the body. So we often refer to the center of the body in yoga as the central channel, where we use ujjayi breathing. Or we just call it our center. So, that there are physical structures that are our center. So this will give you an appreciation for that. Now, where we see with the other lines, as we went through the first 4 full body lines, we saw that they overlapped each other in a number of places. And we don't see that as much with this line because it's so internal. The other lines are external fascial lines, more externally located on the sides and the back and the front of the body, whereas this is deep inside the body. Okay, so they don't really overlap except at the feet, all right, which we'll be looking at. Those of you who know me know the feet are very important. Okay, so let's look at some of the other qualities of the deep front line. Because of some of the structures, which I'll show you in a moment, but they include the diaphragm and the soas and the pelvic floor and the inner sort of fascial casing of the thorax. So all of these structures have a lot to do with, or they reflect our autonomic nervous system state, whether we're in fight, flight, or freeze, or we're in rest, digest, recover. These emotional, mental, nervous system states are reflected in these structures of the deep front line. So you would notice if you're nervous or anxious or frightened or whatever, or even excited or efforting, you'll see that your diaphragm is behaving differently, right? Your diaphragm does not behave the same, during effort or stress, or things like that, as it does when you're at rest. So it's going to reflect your level of arousal, we'll say, of your nervous system is reflected in the diaphragm movement. But also your psoas tone. So your psoas is your deepest hip flexor. We'll look at it very specifically. And, even we'll talk about later, your interoceptive state. So whether you feel the glass is half full or half empty, or, just your sort of how you see yourself in the world at any particular time is all reflected literally in these tissues and structures. So I find that quite interesting. This line also contains our three main bandhas, okay, which is jalandarabandha at the throat, uddiyana bandha around the navel, and mulabandha at the pelvic floor. So these are all contained within the structures, we'll say. Well, I'll talk about that a little more specifically, but these are all located within the deep front line. And this line, in the way that it cooperates with the other lines, is it responds to the tension action in other lines, okay? And so the way it sort of supports the action of the other lines is it creates that center of support. So the other lines help us locomote, right? Move our body around in space or into different postures and stuff. And, a lot of times we're balancing, we have limbs in the air, etc. So we need some kind of stable base. We use, our foot on the floor or our hand on the floor as a point of stability, but then we need something, in the body to be stable as well. And that's what this deep front line helps us create. And it's very responsive, again, full of proprioceptors and these receptors that are telling the brain, where I am in space and what I need to tap into in order to be stable. So that's what this line does. Okay, so now for those of you who are newer here, the way you tap in or bring the deep front line online is by using this method called organization and activation. So let's all practice this now, because we'll do a little bit of off and on and see if you can sense what I'm talking about. So if you could stand and just have feet parallel, that means your great toes are straight ahead and your heels might be slightly wider. You don't want to stand like your feet are turned out, okay? You want to stand parallel. And then it's important to ground through the great toe and the great toe mound. A lot of times in Tadasana, people lift their toes. It's okay to briefly lift your toes, but then you need to ground into especially your great toe and your great toe mound. And then make sure your knees are unlocked and energize through your feet, through your thighs, like you're trying to dial your feet and knees and thighs away from each other. So you're applying an isometric contraction. It's external rotation at the hip. And if you never know that, it doesn't matter. It's just, can I turn that on? Okay, so let's turn it off for a sec. And then ground into the parallel feet. Energize like you're trying to dial the feet and knees away from each other. Some people like to squeeze their heels together too. And you can feel your legs turned on, right? Can you also feel maybe your feet have turned on? And maybe you're lifting the arch of your foot a little. Okay, and you feel your glutes are turned on. Okay, let's turn it off. All right, turn it on again. Dial it out. I shorten it down to dial it out, and that's what I'm talking about, this organization and activation, activating external rotation. Now, can you feel, while you're dialing out like that, activating, can you feel like you have energized your feet? Can you feel like you've energized the inseams of your legs? Can you energize pelvic floor and lower belly? Okay, so now let's just let it all go. Wiggle it out. Okay, let's start on one more time. Press into the feet. Energize like you're dialing the feet and knees away from each other. You could even use a hand and grab hold of your adductors, which are here, the inseams of your legs. Can you feel that they've turned on when you're dialing out? So even if you don't quite feel it in your body, or not sure what you're feeling, you're probably going to notice if you use your hand that those muscles firm up. So I hope that's understandable. Now, pelvic floor comes online at the same time. So if that connection is not there for you, just know that you need to reestablish that sort of mind-muscle connection and you might have a little bit of amnesia there, and you can get that back. Okay, it's just a matter of practicing it. Okay, so let's if anyone has any questions, go ahead and ask. We'll do it one more time. Press into your feet, energize like you're dialing the feet and knees away from each other. Energize through adductors and pelvic floor, and now see if you can energize a subtle engagement of mulabandha, right? Like we're going to begin ujjayi breathing. You notice that lower belly wants to draw in. Pelvic floor and lower belly tend to act together. And if they don't, they've become somehow disconnected, and we need to work on reconnecting them because they really are meant to work together. And I'll show you why that is. There's a connection there. Okay, so that's basically our organization and activation. Is kind of our starting point, our setup position for pretty much all postures. And we use our hands for that as well, and we dial out. So, but that's in previous videos, and we may not get there today. So we'll just work with the foot to core connection. Can you move that? Thank you. Okay, so that's how we access the deep front line. So we don't access it by just sort of thinking about it, although you can, sense it more because you have sensory receptors that feel these structures, and you can get better at feeling them with practice. But especially like movement and activation helps you establish that strong relationship. Without that, it's quite hard to establish that relationship. So, I just comment here that every posture can be a deep front line posture. I think of it every posture as a deep front line posture because I'm always activating this inner stability from which you can take any kind of dynamic movement. There's an inner stability. And, again, as in, previous lessons when I talked about interoception in particular, we looked at, how our inner state of stability really affects our mental, emotional stability. So having a strong connection with your deep front line, with your breath, with these structures that are within the deep front line, even a subtle engagement of the bandhas, all of this awareness that we can bring to it through practice, it actually helps our mental frame of mind. It helps how we interpret stimuli that comes into our life. So, obviously then it's very important work, and it's not just for yoga, right? It opens up new postures to you, new possibilities, but it also helps you in your everyday life and the stresses that you're dealing with there. And ujjayi breath is really a deep front line pranayama technique. So you're engaging, at the pelvic floor, which again, we're going to look at closely. And we're using the diaphragm in a very particular way, right? It's so different from abdominal breathing or three-part breath because we're not letting the diaphragm flatten and push things out of the way. We're asking it to sort of spread at this same level rather than descending and pushing the abdominal contents forward. So we're actually holding the contents in, so there's a bit of resistance. So instead the diaphragm spreads widthwise. So this is, it's again, I think it's just such a valuable training for your diaphragm because the more pliable and mobile and the greater the excursion, which is your ability to expand and contract, the better your breathing is going to be. And that affects every single cell and tissue and fluid in your body. Especially your brain. So, breath is really important, and, exercising the breath and lots of like twisting on the diaphragm and expanding the diaphragm and letting the diaphragm move up and down. It's all really, really valuable. And again, affects your mental state, affects your breath. I mean, geez, it's amazing. So yeah, anytime you're looking for inner stability or spinning around your core center or balancing and finding an inner base of support, inner stability, this is the deep front line's work. This is its reason for being. So of course, like I say, it's not an imaginary line. It's all tissue and structures, and we can locate these. A little bit hard to feel, although, excuse me, I did that palpation exercise. I hope you guys have tried it or will try it. again, it's just another one of those things you can do to bring more awareness to it and establish a relationship and a connection. But yeah, they're very deep structures, so it's kind of tricky to get in there sometimes. But we'll do a little bit of palpating as I go along here. So as I mentioned, we're going to look at the sole of the foot. So right now I'll just briefly mention that the line starts at the sole of the foot. It's kind of what you see over here, what's being shown in this kind of blurry picture is your posterior ankle flexors. So when you think of pointing your toe, what's happening at your ankle is plantar flexion, okay? So flexion. And these deep muscles, these are under your bigger ones that are more superficial. These muscles here, their tendons go around your inner ankle, not your outer ankle, inner ankle, and they spread out over all the smaller bones in your foot. And so they're very deep arch supports, okay? And we're going to look at the tendon for the toes and the great toe, especially because these are really, really important to understand something about. So if we're starting from the foot, we go up the back of the calf here, and then we go into the adductors. So you have 5 adductors. 3 of them are short, 2 of them are long. You don't have to remember that. But look at the wad. Like so many people talk about this wad of tissue, and it's not a bunch of fatty tissue. It's 5 muscles, and one of them in particular is a really large muscle. So you have all these muscles in the inside here connecting your femur bone to your pelvis, basically. So they're going to help position your pelvis, and they're going to help stabilize the pelvis too. Okay, so we'll look at those briefly. So these, when I say activate the inseams of your legs or draw that energy or tense or firm the inseams of your legs, this is what we're firming, is these adductor muscles. Okay, and then it gets a little bit crazy with the with the deep front line, because we start spreading out more on the horizontal plane instead of going straight up. We start spreading out, and there's going to be a layer that's toward the front of the body and a layer that's toward the back of the body. Interestingly, I sort of forgot to mention that I know we call the deep front line, there's no shallow front line or no superficial front line, right? We do have a superficial front line, we have a superficial back line, and we have a deep front line. We don't have like a deep back line, right? It's just the deep front line, and it's called the front line because it's for the most part, in front of the spine, okay? And yeah, I'll leave it at that. Who knows? I mean, Tom Myers named all these structures and lines and everything, so that's probably enough to say about that. It's his thing. So let's look from the adductors here. It flows up the pelvic floor. So it's interesting to know, and it's hard to tell on this picture. We'll look at other ones, but these adductors flow over. This is the ramus of your pubis, right? This is your pubic bone. And then a ramus is a branch. So this is a branch of your pubic bone. And the fascia from these muscles flows over that bone and into the pelvic floor. So there's a solid, continuous fascial connection from your adductors to your pelvic floor. And you're going to see that there's also a very strong connection from your abdominal muscles to your pelvic floor. So we'll look at that in a different image. Okay, so now there's some really interesting structures here. So a lot of people know about the psoas, especially. So here's the psoas, just this strip of muscle right here, okay? Just this strip right here. What you're seeing on the inside is psoas minor. Not everybody has that. So this is the psoas right here. It's basically the tenderloin of the human body. Right beside it is the iliacus. So, they operate together, these two. Iliacus has, kind of its own set of problems. It really is prone to trigger points right here. But the psoas is the most notorious in terms of having trigger points and a lot of people describe it as tight, but what it is overactive, right? It's prone to spasm, and some people feel like it's literally catching fire in boat pose and poses like that. So it's that what I would say is over recruited. Not even necessarily tight or really strong, but it's over recruited, pretty much exhausted, and it really complains if you overwork it. Then we have the transverse abdominis. So it's really hard to see on this picture. What you see in these slightly diagonal fibers here, that's your transverse abdominis. On this side, you can see how it comes around from the spine and actually wraps around all the way to the front, but we don't see the abdominal aponeurosis on this skeleton. So just know that it wraps all the way around. And I do have another image where you'll see that. Okay, so transverse abdominis is also, its fibers go across the front of the lower abdomen. And this is often talked about in yoga. It will be suggested that we engage the transverse abdominis because in yoga, we do talk about the transverse abdominis generally to, in ujjayi breathing, etc., but also as, core support. We use the that is mentioned quite often. And that's because its job is to withdraw, to compress actually the abdominal contents. That's how it's called. So the transverse abdominis compresses the abdominal contents. So it pulls your belly in. But there's other muscles that do that too, and that's your internal and external obliques, which are part of the lateral lines and spiral lines. So just so you know, it's not trying to do that all by itself, but it is kind of the initiator of that action. Again, I don't know why I'm telling you all this. I just find all this stuff very interesting. You also see, I have it labeled on this side. This is your quadratus lumborum, QL. Let's feel our QLs, shall we? Let's stand up. And you see how this is right along the pokey outies of your spine, the transverse processes, and your last rib. So if you take your thumbs and you push your thumbs under your last rib up against your these bony edges, then you could just lift 1 foot off the floor at a time, like just as you're standing straight off the floor, and you're going to feel muscles kicking on. Okay, so hopefully that's what you're experiencing. Those muscles are the quadratus lumborum muscles. A lot of people will have complaints about their quadratus lumborum. They're also very prone to spasm. These muscles that we're looking at, the psoas, the QLs, the adductors. We're going to look at some of these back here. These are your lateral hip rotators, especially piriformis, but we'll have a closer look at those too. All these muscles are what we call postural muscles, means that they're tasked with holding you upright. And so they're of a muscle fiber type that tends toward endurance. And they get turned on a lot and expected to sort of stay on to hold you upright. Even when you're seated, your torso is generally upright, right? Unless you're in a total resting pose. So these muscles, especially QLs and psoas, adductors, they're holding you upright as endurance muscles, not as like big, strong, powerful muscles, but as, those endurance type muscles. Okay, so that's that. And then the diaphragm, which you can't see all that well, but I have other images. Your diaphragm, if you can see how one lobe over here, another lobe over there, it does form a very much a dome-like structure, or even you could think of it as like, a hot air balloon or a parachute or something like that. No, a hot air balloon's too circular, but a parachute. And it even has like strings coming down from it that are called crura. So, the diaphragm is Also kind of an interesting muscular structure, because about 50% of it they call autonomic. So again, it's just being stimulated by the phrenic nerve, and that's why you breathe all the time, even when you don't think about it, even when you're asleep. But about 50% are voluntary muscle fibers. So that's why as soon as we bring our attention to the diaphragm and start to observe our breathing, it grows, doesn't it? I think we all have that experience of it. It's immediately possible to take a deeper breath. So that's because some of these are voluntary muscles that you are in charge of completely. And of course, as we know, if you're yogis and you've been through teacher training and everything, you learn that you actually have a lot more conscious control over some of these autonomic processes than we're told, right? And that's because it's a mind-body practice. We are working on our interoception, working on our the sensory experience and controlling our breath and developing our breath, which is very much influences heart rate, etc. So, some of these things that are involuntary, we actually do have some conscious control over it with practice. So again, just really interesting stuff to know. So it's hard to see on any diagram, but the fascia that's inside the ribs and that surrounds your lungs and your heart, that is also part of the deep front line. So both in the front and the back. And it kind of emerges above the rib cage to be your really deep neck flexor muscles. And, a lot of them are actually on this front side of the spine. This is your spine. So you would have to move the trachea out of the way, and those muscles are deep to that. Okay, this is your windpipe and your glottis. You would move that out of the way, and it's in front of the spine. So yeah, we're talking about deep structures here. Okay, so some of the muscles, and you can feel these ones too, some of the muscles that are included in this line are your chewing muscles. So you can feel like just the sides of your face here, these muscles here, these are masseter muscles, super, super strong muscles. So if you just clench your teeth a few times, you'll feel those muscles turn on. And then you can come up here like, sort of your eye level, just beyond that into your hairline. And if you take a few chews or whatever, you'll really feel those muscles. That's your temporalis muscles, and those are chewing muscles too. All right, so some really interesting muscles in this line. They're all very deep muscles, and some of them you probably know about, like the psoas, like your adductors, for sure, and the diaphragm, of course. Okay, so let's move on. And, as I mentioned, we're not looking at a streamlined fascial line, but we're looking at a very connected fascial line, right? All the same. So that's kind of one of the reasons why they're called lines, is because they're continuities, they connect. So you want to think about, it's a series of springs and slings and domes, and they're all connected one above the other. So you could think of the domes as sort of like the tent, but I also think of the entire tensegrity structure of the body as sort of a tent-like structure, because, you need tension through, especially in movement and especially in asana, to tense the fascia and like spread out the effort and distribute the tension throughout the tissues. It's very much like creating a tent or a kite or something like that. That's how I experience it anyway. But we can also think, domes are very strong structures in architecture. And so we have a number of domes, like the crown of the head is a dome. The epiglottis and the throat, which I'll show you, is dome-shaped when we close it or when we constrict it. And then we have the diaphragm, which is distinctly dome-shaped. And then we have the pelvic floor, which I would say is more sling-shaped or more like spread out like this. This is a sunshade, but it's just sort of pulled here, attached to bones, and then it's sort of a soft tissue floor, in the pelvic floor. And then we have the arch of the foot. So we've looked a lot at the foot, so I won't spend too much time on this, but you want your foot to be like a springboard for your body. So this is why it's important to maintain the arch of your foot, maintain your toe function, your entire foot and ankle function, because your body is built above that, right? And so pretty much all of your joints are affected by what goes on in the feet. And that's just, feet often get left behind, but you can cause a lot of dysfunction in your body by not taking care of your feet. So this is a really high priority, especially if you're teaching people who are getting older. But I mean, you want to catch people as young as you can and get them to be aware that they need to take care of their feet. But, if the older you are, the higher the priority becomes. Okay, so we actually need the foot to, yes, be fully able to relax, but also it needs to become a rigid arch too, like a rigid lever for the body, especially in walking. So yeah, it needs to be able to be like off on, off on, off on. And so things like toe standing and using downward facing dog and doing postures, malasana, that will maintain your ankle range of motion is very helpful too. So now I want you to just look at these structures, the tent, the sunshade, the springboard. This is a gymnastics springboard. What do they all have in common? Like, what do you sense when you look at them? Does anybody want to take a guess? What do these all have in common?
Springy. They have like you can take off.
Did you say springy?
Yeah.
Yeah, I would say, like, if you threw a dime or something, or maybe something heavy or a rock at this tent, it would bounce off, right? It's probably the same thing here, even though this would float up and down in the air. So what is it? What is springiness? What would you say springiness is?
Tension.
Yeah, it's tension. That's right. So this is why we need to understand tension and know how to work with it so that we get, we have, this integrous, balanced, harmonious, springy system, at whatever part of the system we're talking about. Those are qualities that really enhance your movement life and enhance the health and function of the tissues and joints. All right. So that's very, very important. Now we're going to look at the pelvic floor and some of these connections. So let's go over here first, because now we've got a really close-up view. Here's the diaphragm. This is the front edge of, it's the front edge of the diaphragm. I don't know why they took the cartilage off, but these ribs would extend a little bit further with cartilage. I don't know, they didn't show the cartilage here. So just know that those ribs don't stop and your diaphragm keeps going because it's hooked on to the cartilage of the ribs, and then dome shaped up here. And it's got these long, this is crura. See this side and that side? So these are mostly fascia, even though this is red. These are mostly fascial attachments. So you see how these legs or strings, just kind of like a parachute, come down, and they're basically overlapping with the psoas. These come down, your psoas. We saw that a lot in the other lines, how one part of the line overlapped with another and they sort of hook on. So a similar thing is going on here between the diaphragm and the psoas. They are in a relationship together. Okay, so let's continue down. Here's the iliacus, as I mentioned. And your psoas attaches to the inner aspect of your femur. This is your big thigh bone. So right in here. So you see how it actually wraps over. This is your pubic bone, and this is the ramus. Remember, the branch of the pubic bone. So a lot of people, especially in yoga, especially if they're doing sort of passive deep lunges, they're pressing their psoas up against this bone. And that can cause a lot of tenderness. So we see that a lot in yoga. And then this is the muscle that wants to catch fire when it's in a short position. Now, especially if it's been constantly lengthened in lunging poses and stuff, and you're starting to change the chemistry and whatnot in this muscle, which is what happens when it gets compressed a lot, then it's not going to be happy when you shorten it either. So the important thing is just to create balance. And what I recommend as most of you know, is using tension, right? You're going to use tension. Have the fascia, so you're not isolating this muscle by itself. You're using the fascial lines, like the front fascial lines, the superficial front line, to activate the fascia. So it's the fascia that's carrying the tension, not just this muscle getting compressed against the bone. Okay, so we use the fascia to take up tension and distribute tension. We use the muscles to tension the fascia, to create that tension, and then the fascia carries the tension. And this is really, I mean, this is a module 1 concept, really important to understand. So, you know, that's going to be a major takeaway, understanding how organization and activation, what are we trying to do? You know, we talked about using tension forces and what that does. In module 2, we learn about what's the effect of tensioning these tissues actively and frequently. And we understand now that it helps us develop our next generation of those tissues, and they're going to be laid down in an organized manner. And this helps them be even better at carrying tension. So, you know, we're developing our future body here. So again, don't want to spend too much time on that, even though it's really fun to talk about it. Okay, so yeah, we're just sort of working through these muscles. Now, here's some of your pelvic floor muscles. The ones that run front to back are part of the levator ani group, and you may have heard of these. This is the pubococcygeus, so pubic bone, and this is your sacrum. Base of the sacrum is the coccyx, so it's pubococcygeus, runs from front to back. And then you have these other fiber directions from pelvic floor. This is probably, could be even the gemellis here. So that's the pelvic floor. So not in this diagram because this is not real. This is a computer simulation. But if it were real tissue, like on a dissection table, you would see that the fascia continues over from these muscles, goes over the bone into the pelvic floor. These muscles rise up the inside of the sacrum and all the way up the bones here of the vertebra. All fascia, continuous fascia, strong collagen fibers, very, very connected. Okay, you know, these kind of computer images are helpful in some senses, but they hardly ever show those fascial connections. So unfortunately, you'll have to take my word for it there. Whenever I can, I get dissection pictures because I think you learn a lot from that. So now let's look at the layers of the pelvic floor. So when I say the deepest layer, this is the most internal inside your body, okay? And this is where you're going to see the levator ani group. So you may have learned when you were learning about mulabandha that you sort of draw the pelvic floor slightly together, and then you want to create an uplifting energy through pelvic floor. So it's not a maximum contraction. You don't have to squeeze your butt for it, but I do want to suggest to you that actual mulabandha extends below your feet. So you're actually pressing into the root of mulabandha, pulling it up the inseams of your legs to your pelvic floor. So this is very much reflected in all the structures of the deep front line. And you are lifting because levator ani, these 3 muscles, when a muscle is called levator, that means it elevates. So if you can contract this muscle, you will elevate your pelvic floor. All right. So you're elevating it. It's subtle. You know, we're not looking at a maximum contraction. That would be very distracting in movement, but you're just elevating it, just turning it on, activating it. Then you have a middle layer, and in this middle layer, there's this very strong transverse ligament. So if you ever go into the myofascial rolling videos that are in the website, when we're working on the pelvic floor with the ball, we're sitting on these ligaments. Or I shouldn't say these ligaments, this very strong transverse ligament. And that's going to help with the pliability and the fluid movement of the pelvic floor. And then you have your most superficial layer here. So you can see there's a number of different fiber directions, but taken as a whole, when you activate the pelvic floor, it's an uplifting energy. You feel like you're lifting the pelvic floor. So elevating the pelvic floor, or, you know, drawing upward, pulling the energy upward, all of that kind of reflects what's actually happening at the pelvic floor. And, you know, a lot of people have heard conflicting things about the pelvic floor. A lot of people say that, your pelvic floor is too tight. It could be, reflexively tight, like some kind of trauma response or something like that. But in general, I mean, it's muscle. It's several layers of muscle and fascia. And to any muscle and fascia, to get it strong and functional, it needs full excursion, right? So you need to be able to fully contract and fully relax. If you're losing either of those ends, you don't have full function. If you can't fully contract and you can't fully relax, now you've got dysfunction. And there might be compensation patterns going on and various things like that. So, it is simple. What I would say is, for anybody, whether they've had pelvic floor issues or not, organization and activation is going to help them. And then developing mulabandha, so bringing awareness, starting to understand, using, here's what the mistake that people often make is they'll try to activate and they can't maintain the activation very long. So they just get tired and quit. But going to the point where you can't hang on anymore is perfect. You go there, you take a break, you try going there again after a little break, then you take a break, then you go back. This is how the brain recognizes that you need that muscle to be stronger. So it starts working on that for you. Okay. Without that information, the brain is not going to set anything in motion. We learn about the adaptation response. This is another adaptation response. So we're talking about, like, give the system the information it needs to initiate that response. So working with the pelvic floor, and I'm not talking about Kegels, I'm talking about, which I have no objection to Kegels, but, it's making pelvic floor part of your continuous deep front line and using the deep front line as your core support. It's part of something else. It's part of a longer chain. And maybe if it's treated that way, it's going to start functioning better over time on its own. Okay. So, there's lots you can learn about it, lots we could talk about. Feel free to ask some questions if you need. Okay.
Lee has a question.
Oh, Lee has a question.
She said, I've only heard the perineum mentioned in Iyengar classes, and I did not know what they were talking about at the time. Are we also looking at the perineum here in this slide?
Well, the perineum is more of a fascial structure, but basically, yes, like the pelvic floor is generally what they're referring to when they call it the perineum. Yeah. Yes. And there's a follow-up question.
Yeah. Donna said, did I hear you say that mulabandha starts at the feet? So can you engage mulabandha when seated for real?
I think so. Yeah. I think you can engage mulabandha when you're seated. It's more of a, like, if you're in Sukhasana or full Padmasana or something like that, your legs should be turned on. There should be a level of activation. And I'm not saying that you can't engage mulabandha. Like, if your legs didn't work, you had no neuromuscular innervation for your legs, you could still engage mulabandha. But I'm just saying that energetically it extends below the ground. So I find this is really helpful because people talk a lot about grounding these days, and knowing that your, energy body extends beyond your body, right? So if you're pressing into the ground, there's like an aspect of your energy body that's like deep to the ground, and you're pulling. The more you press down, the more you pull. You receive energy upward. So, and again, this is a concept my teacher explained to me. I'm accepting that that's the case. It certainly feels like that for me. So that's what I mean by that. There's a lot of optimal ways of doing things. And, like, maybe you're not going to get the same kind of mulabandha engagement if you're not on your feet. I mean, especially if you're trying to reawaken the pelvic floor, I would do it on the feet. I would always have your feet need something to press into. We'll look at some of the reasons why to help you reawaken the pelvic floor. It's really hard to do that in a seated position. Your pelvic floor turns off in a seated position. Now, you can activate it consciously, intentionally, but otherwise, like if you're just at a desk, trust me, your pelvic floor is not active. Okay, it's just going to be shut down. And so are your lateral hip rotators and whatnot. Your psoas might be a little bit active, but a lot of muscles are shut down when you're seated, unless you are intentionally bringing attention, concentration, activation to the area. All right, I hope that's satisfying.
Lee says it feels like when you organize and activate the feet and dial the knees out, then you automatically activate the pelvic floor.
Mm-hmm. Yeah, so Lee is saying when you organize and activate through feet to core, you automatically activate pelvic floor. Now, I think it's possible, like again, this sort of sensory motor amnesia might prevent you from having that experience, but it is available. It can be, you can return to it. You can establish a stronger relationship with that. I would do it through movement and sensory experiences. But you can't really think yourself there, is what I'm saying. But yeah, automatically, if everything is functioning well, there would be pretty much an automatic engagement. I've tried to experiment with it myself. Like, I find that I can't organize and activate and not engage my pelvic floor. However, if I didn't organize and activate, and then I tried to engage my pelvic floor, I can do it a little. It just feels like there's like nothing underneath it. You know what I mean? So seated position, I would definitely ground into my sitting bones. That's an action, right? That's actively grounding. And you can get some upward lifting from that. So that's a little bit better. But if you're on your legs and not really activating them, then pelvic floor is kind of, it's less active. So, and like I say, the more you practice with this, the more you tap into the sensory experience, and this is what I say over and over again. It's not really about the alignment. It's about how it feels. Can you get to that feeling? That's what really matters. That's what really starts to change things, because your conscious thought can change the movement of energy. And we are energetic beings. So, we are energetic beings to the point where tension repolarizes our proteins. Like it's really phenomenal. So, any other questions?
Pooja wants to know, how are mulabandha and Kegels different?
Oh, well, mulabandha is more of a isometric, so you just, and especially, it's, unless you're doing a pranayama technique where you're doing a breath retention, right? Either an exhale or an inhale retention, and you're holding, right? Like at the end of Kapalabhati breath or something, where you're just going to hold. And maybe you're applying a full uddiyana bandha after a out breath, and all of that. Then you would be a very strong isometric contraction. That's a contraction where there's no movement. It's just a hold. That would be a strong. But for ujjayi breathing, for movement, we're using a subtle engagement of mulabandha, and it is isometric. Whereas a Kegel is contract, relax, contract, relax, contract, relax, contract, relax. Okay. So, and I'm like I say, I'm not opposed to that. It's, I guess, a little bit knowing how to contract, because depending on how you've used your body and, what, maybe even the kind of coaching you've had before and things like that, just different experiences. Even people who deal with like a lot of constipation, they practice bearing down so much that their pelvic floor, the way it activates is downward. It's not lifting. And again, that's just through practice. Remember, I was saying, what you practice repeatedly starts to change your body, and it's definitely going to change how your body turns itself on. Okay. So, just depends. For the most part, people are going to lift. That's what the muscles are designed to do. But your abdominal wall is the same, right? I've worked with people who don't know how to compress their abdominal contents, because when they turn their muscles on, they push them out, right? So it's all part of this directing the energy upward. if we push out with the belly, if we push down with the pelvic floor, it's a downward energy, and we want to pull the energy upward through the tissues. So I think that really helps people understand, lifting the pelvic floor, how to engage the core, etc.
And the last question.
One more question.
Anisha asks, Kundalini seated practices consciously engage mulabandha and are effective, aren't they?
Yes. I mean, mulabandha, working with mulabandha is very effective, period. Because, and like there's other things too, but I would say, if you practice mulabandha, you can do so many other activities more successfully because you are using your deep front line. Mulabandha helps you engage this pelvic inner stability. So yeah, it's very effective. So, any way you work with it, but I would say that subtle engagement of mulabandha, every now and then a very strong engagement of mulabandha is great if you're doing some pranayama or breath retention at work or whatever. So you want to be able to be subtle, you want to be able to be strong, you want to be able to be relaxed, you want to be able to be super active. All of these characteristics are characteristics of any muscle, right? You've got fine motor skills and gross motor skills. So you want to have the same skill with your pelvic floor. And, I guess I could probably do a whole call on that, but, there's many ways of doing it besides just Kegels. I never really found Kegels a lot of fun. I prefer to, just do movement, squatting of various kinds, to engage the pelvic floor. Even lying in happy baby pose and grabbing the great toes with your peace sign fingers and letting the knees drop down beside your torso and then pushing into the fingers as hard as you can. You get really good pelvic floor engagement. So taking a few rounds of that is much more interesting to me than doing Kegels or doing little bridge poses for pelvic floor activation, or using the myofascial rolling ball for that, and really like bearing down and pulling up. And, there's so many things that you can do. So, it's not just Kegels. I find that would be difficult for me to stick to, I think. The other thing like we could do is bouncing. So I know like if you have what feels like weakness at your pelvic floor, but it's really just dysfunction, doing bouncing activities, because, when your body comes down and you go up again, your pelvic floor has to hurry up and respond. So it teaches your pelvic floor to rise up again, just like your arches have to become active when you bounce. So you could keep your toes on the ground and just bounce on your heels, or you could have your toes leave the ground a little bit, just like, you're skipping with a rope or something like that. And the other thing, when this was a few years ago, I felt like I had a weak pelvic floor in running. And so I bought a trampoline and I jumped up and down on the trampoline, because if you don't challenge the system, it's not going to get stronger, right? So, and then, the way I practice now is so good for my pelvic floor. It's just part of, like I say, every posture. That's my perspective. I'm using my deep front line, and my pelvic floor is part of my deep front line. So that's how I approach it. Well, shall we? Yeah, I'm afraid we may come up against a number of things in this presentation where we could spend a lot of time. Okay, so I wanted to just discuss some of the troublemakers and some of these connections a little bit more here. So let's look at the dome here of the diaphragm. This is where your QL is. That's the muscle that we palpated. So the troublemakers, we don't usually hear people saying, I think my diaphragm is too tight. People are so disconnected from their breath. In fact, they might have a very dysfunctional diaphragm and not really understand that. But your diaphragm function is going to affect your entire life. Like I say, every cell, it affects your blood, right? It affects your blood chemistry, how much air you're taking in. If you're effectively exhaling effectively inhaling, and whether or not like you can breathe in compressed positions, right? Like when we take the body into side bending or twists, we're actually either twisting the diaphragm a little bit or compressing it, and then it has to work against that resistance, and that is excellent for your diaphragm. It really improves the pliability and the extensibility of the diaphragm. You know, it keeps it bouncy, like we were saying. Yeah, we want that bounciness. That's how you keep your diaphragm bouncy. Give it lots of different challenges and push your breath into them. I always say, like, press your breath into the tissue. And so that's a really great way to take care of the diaphragm. But other troublemakers, like a lot of people will complain about their QLs. They'll say, you know, they have a really tight back. QLs are attached to your last rib and your pelvic bone here. So they are breathing muscles. And what I would say to you is that a lot of times back issues are a deep front line and superficial front line weakness or disconnection, sensory motor amnesia problem. Okay, so if you want to help your back, you think about working with your deep front line and your superficial front line. All right, so here's where I wanted to show you the transverse abdominis. So if we laid the transverse abdominis over this picture, it would cover everything you see here. So all of these structures are deep inside here. Multifidi are just the little muscles that go from one vertebra to the next. So sometimes these are grumpy too. But, you know, when you kind of lose an integrity here of the superficial front line and the deep front line, then your back is going to be overworked. You know, your back is loaded with those postural muscles that are trying to keep you upright, and they're just going to be turned on and overworked all the time. You're supposed to have balance between the front and back. And so your deep front line is kind of mediating the tension in the deep front line, in the front line and the back line. It's mediating the tension between those two. So I think, you know, we did talk about how to work with the superficial front line to make it a bit stronger and make it turn on better. But working with the deep front line is going to help a lot too. So let me now show you this continuous connection of your abdominal. This line, we'll say, represents your abdominal fascia or abdominal aponeurosis. And it's multi-layered. Your transverse abdominis flows into it, then your obliques, and then your rectus abdominis, all layer upon layer of fascial tissue. It comes down, and now there's a layer that goes inside the pubic bone. So here's your pubic bone. Yes, there's a layer that goes over the pubic bone and connects with the soas over here. But there's also there's layers that go to the inside of your pubic bone and are continuous with the pelvic floor. So you literally have a continuous sling of fascia coming down from your head, down the fronts of your vertebra, the front of your sacrum, the floor of your pelvis, behind your pubic bone, and all the way up inside your rib cage. So you have a continuous connection there. So, you know, if you know there's a continuous connection, then I think it's a bit easier to tap into that rather than thinking of your pelvic floor as this thing unto itself and your transverse abdominis as a thing unto itself. These things are connected, and pelvic floor and transverse abdominis are very connected functionally. So when you're stabilizing your core, these two muscles need to work together. So this is basically the floor of your core canister, whereas the diaphragm here forms the lid, I guess, lid of the core canister. And then you have this layer of muscle, and then you have your, obliques and your rectus abdominis. All right, and in the back, you get some additional support from the QLs, but mainly it's these more superficial muscles. Okay, so when we say, like I say a lot in my classes, I draw the energy up through pelvic floor and lower belly. You want to sort of practice getting these two to operate together. they do naturally, but it is possible to sort of disconnect from that if you're not practicing in such a way that, you're reinforcing that connection. That's what we want to do. Okay, and then, the other thing to know is the action of the diaphragm and pelvic floor sort of reflect each other. When something moves in tandem, it means they go up together and they go down together. So when you exhale, your diaphragm domes, and when you inhale, it flattens a little bit. And this is true of the pelvic floor too. So when you exhale, you'll find, your diaphragm goes up, but you'll find you can squeeze your pelvic floor a little bit more when you exhale, yeah? And then when you inhale, there's a downward pressure. It's a downward pressure from the diaphragm, from your abdominal contents up against your pelvic floor. And so I wouldn't want you to be afraid of that downward pressure, because you have to think of it, that downward pressure is challenging my pelvic floor. That's going to keep it strong. Okay, so, you can work just with the pelvic floor and breathing, right? So you work with contracting pelvic floor a little more strongly when you exhale. And then when you inhale, just let it go back to, its resting length. Contract. Okay, so I know it's kind of hard to wrap your head around, but in your body, it's not hard. So when you exhale, you squeeze pelvic floor. Just remember that. And then again, you can work with strong contraction or subtle contraction, and work with different leg challenges and stuff too. See if you can maintain that activation while you do other leg actions. Yeah, again, I don't want to stray too much because I could talk about this all day. Yeah, it's lots of fun. Any questions before I change slides?
No, you can carry on.
Good. Away I go. All right, let's look at, I'm just working through all the structures of the deep front line, and then we'll look at postures. So the epiglottis, you guys heard of the epiglottis? It's kind of this connective tissue flap. It's kind of cartilaginous that protects the windpipe. Well, it doesn't protect it exactly, but it's so that you don't choke. So when, now if I had taken a picture which was not swallowing, so this is supposed to be, I don't know, peas in a pod or something. Somebody's going to swallow that. That's not going to go well. But if you were just breathing and not ujjayi breathing, just relaxed breathing, this piece of cartilage would be standing straight up. When you go to swallow, it bends down. And also when you constrict the glottis in the throat, you are constricting with your epiglottis. Okay, so it's kind of, when it's active, it's kind of dome shaped. All right, and so that's just another dome. I'm just interested in how many domes we have. So when you're ujjayi breathing, you have the slight constriction at the throat, and that is your epiglottis is providing that. And we do that, right, because it does help channel the breath. It does help. It helps sort of slow down the breath and provide more time for air exchange. And also it's a concentration technique. So there's lots of reasons why we do that. But I just thought it would be interesting for you to know about the epiglottis, which is part of the deep front line, all of these structures. All right, and then another interesting bunch of muscles are your deep six. So when we externally rotate like we do in organization and activation, we're activating these muscles because they're lateral hip rotators, or I could say external hip rotators. I think a lot of you are more comfortable with the term external. So it means they want to spin this bone outward, right? That's the center of your back, center of your buttocks, and your big femur bone. That's the greater trochanter. And when you dial it out, you're squeezing these. Now, yeah, you're squeezing your big muscles on top. It's not about squeezing them though, right? It's just directing that activation. But these muscles are the deepest muscles around the joint, and they sort of initiate the action, and they're very much about stability. This is their job, is to stabilize the hip joint. And there's 6 of them. But the one you may have heard about the most is the piriformis. Again, this is kind of a big complainer. And a lot of people overstress this for a couple of reasons. Like if you're a yogi and you like to do pigeon pose, this is the muscle that is getting the most tension in pigeon pose. If you're doing a passive pigeon pose where you're not turning muscles on, it's going to be this one. I generally do active pigeon, or what I call frisky pigeon, which means like I'm pressing my legs into the floor, and that makes all these guys go to work. They cannot sit there on the sidelines. They all have to work. So it is a way of keeping all of those lateral hip rotators strong and operating together. Because here's the other reason why piriformis gets so overworked and unhappy is that it's the one that initiates the action. And a lot of times if these ones are weak, this one is the one that's always being used. We always have that, if you have a bunch of muscles that are supposed to work together, there'll often be one that gets overused if the other ones decide to be lazy. Okay. And that can be a movement pattern. In this course, I talk a lot about patterns that develop in the body. You could have a pattern of just relying on your piriformis to stabilize your hip. And it doesn't really have a good mechanical advantage or leverage to do it all by itself. It needs these lower ones and even deeper ones. So good ways to do that is to be in a lot of standing balancing and challenging standing balances, but also pigeon pose where you're pressing your folded leg into the ground, your front leg, whole leg. And there's lots in the experiential exercises. I'm sure I've done it a few times in there. Things like little bridge pose, where you really intentionally getting all of these deep hip stabilizers woken up. Okay, so they're a lot like the rotator cuff muscles in the shoulder. You have 4 rotator cuff muscles. They're deep, and that's also their job. Shoulder's a ball and socket joint. Hips a ball and socket joint. They have these little muscles that help stabilize that ball and socket joint, and they're very important. And stability is really their task. So when you habitually organize and activate, you're going to help get these stronger. And then, in your practice, just make sure you're doing postures in such a way that they all have to work together. My suggestion to you. All right, so let's look at, while we're here, we're in the deep front line, and there are, the bandhas in this line, and we could also think of the chakras being in somehow related, have something to do with this deep front line. So, especially every now and then when I go looking for more information, I realize how many perspectives there are out there. So it's always kind of mind-boggling. So, all I'm going to say about bandhas is we use them, right? We use them in pranayama techniques. They're very effective. We use them in dynamic movement and held postures. So asana. And I find them very effective in working with the breath, challenging the breath in various ways, and stabilizing asana, as part of the deep front line. So, whether people think they're real or metaphorical or something like that, where I'm not interested in that discussion, but I do use them myself, and here are the structures that we're using to create those bandhas. And when we call them locks, which I understand is the translation, or at least it is translated that way, at least sometimes, we don't need to think of them as like locked up or shut out, or nothing passes through, because like the locks on a river system, it is for the passage of something, right? It's to facilitate the passage of vessels through a waterway that changes levels, right? So you could kind of think of that. It's sort of facilitating breath and energy. So that's what I'm going to say about it. All right, so we have the mulabandha. What is it that we're activating when we apply mulabandha? I would say mainly it's levator ani, that 3-layered muscle that elevates the pelvic floor. remember levator, think elevate. So that's what we're doing, what we're engaging. And again, it could be strong if you're holding a breath retention. It's never really a full out effort, but if you're, holding a breath retention, you might engage it a little more strongly. And then more subtle engagement for ujjayi breathing. Uddiyana bandha is, again, like, obviously very strong technique. You're using mainly your transverse abdominis, but as I said, you have other abdominal muscles that compress the abdominal content. So it would involve your obliques, internal and external, but we're going to say mainly transverse abdominis, and you're pulling it up and in, and creating a vacuum and all of that. But of course, we're not doing that when we're ujjayi breathing, right? We're just using a subtle engagement. So I would think of that as just engaging, activating your deep front line. That's probably the best way to think of it. It's a subtle engagement of uddiyana bandha. And jalandarabandha, again, could be, tucking the chin to the throat, completely holding for breath retention, or it could be like we use in ujjayi breathing, where there's just a subtle constriction there to channel the breath, heat the breath, focus the energy, all of the good things that are part of that breath technique. Okay, so those are contained in the actual structures of the deep front line. And then I think most people would agree that chakras are more of like energy centers. So we're not looking for actual physical structures per se. But I would say that with practice, these can also be felt. So whether or not they're attached to a specific tissue structure, I wouldn't say that perhaps, but you can definitely feel probably a level, I don't know just how to describe it, level of vibration or even heat or even pulsation. So, with sufficient practice, interoceptive work, mental concentration, lots of breath work, of course, and then being aware of the structures of the deep front line, just the location, their qualities, and in module 2, mostly you're going to learn about piezoelectricity and mechanotransduction, which helps you understand that these tissues are electric. They are, vibratory. They are polarized. So there is that quality, and you can, you actually can sense that with practice. So just something to look forward to. Okay, let's go on, and the last word goes to the foot, and I feel that the foot always should have the last word, if not the first word. So let's just look at, again, we're worked our way down now, and we're back in the foot. So this is the back view of the foot, and this is the sole of the foot, and see all the tendons coming underneath the foot into the arch of the foot. Let's look over here into the arch of the foot. First, I want to draw your attention to tibialis posterior. You can see how this spreads out. Unfortunately, it's under the toe flexor tendons, but it does spread out. It touches all of the bones in the arch of the foot, actually. Now, tibialis anterior is this muscle here. Okay, it wraps around the tendon you feel on the inside of your ankle is one of them. Okay, so this one, and then you have flexor digitorum. So this muscle is cut, but that also wraps down inside, and then it spreads out like this. So when you say digitorum, right, your digits are your toes, and it's flexor, so that means it curls the toes under. And it's long because there's also a short one, but we're only interested in this long one. So that spreads out. So these 4 toes, but look, your flexor hallucis, your great toe, has a muscle all of its own. Here's flexor hallucis longus. So your flexor has this, your great toe flexor has this very strong tendon. It's very straight tendon. So when we say great toe straight ahead, this makes perfect sense. And then it has its own muscle, which is part of this bundle of deep front line muscles. which is connected to your adductors, which are connected to your pelvic floor. So this is why I really want you to be able to experience your foot to core connection, which encompasses that great toe, especially arch of the foot, inseams of the legs to your pelvic floor. And we can experience that and strengthen that connection and relationship in our practice. And I think this is where you really get healthy, functional pelvis, you know? So now I just remind you that all of our lines so far, all the other 4 we've looked at, superficial back line, superficial front line, lateral lines, and spiral lines, they all had connections into the sole of the foot. So they are all part of active arch, active foot function. Helping, you know, so like just think if you're trying to help somebody improve their stability, their balance, say, I want to improve my balance. I want to be able to stand on one leg. Can you do that without a fully functioning foot? No. The foot has to be functional. You know, the toes have to be able to move and spread and root. And the arch has to be able to lift, because I'll show you a picture in a minute where you can just see when the arch drops down, everything collapses above it. So, you know, the foot is really important to work with if you want to improve balance. And most people want to maintain their balance, because not maintaining your balance leaves you open to falling, which can be a complete disaster, especially if you're older. Okay, so all of these muscles, you know, and their tendons, they're working together to create that springboard action in the foot. We want a nice bouncy, resilient foot, and creates that support structure, right, for the rest of the body. And yeah, I wanted to make sure I talked about this great toe to pelvic floor connection through the deep front line. Again, like if you want to help somebody improve their pelvic floor function, you need to work with the great toe. Foot to core. Okay, not just pelvic floor, foot to core. Use your feet. That's why I even suggest grabbing, you know, in happy baby pose, grab your great toe and make your great toe push into your fingers while you pull with your fingers. You'll activate your pelvic floor for sure. All right. So now, you know, everything we've been talking about has been about creating that inner stable base of support, which is what the deep front line is mainly doing. If it has a functional movement, it has more to do with sort of being the moderator, right, between all of these other lines that are more active lines or have more movement function, more movement task, I guess. Okay, the other lines, yeah, they motivate movement, whereas deep front line stabilizes movement. Now, you know, we talked about organization and activation, and there's this term that we use in the yoga world. I don't know, maybe gymnastics uses it, but in orthopedic assessment, you would never hear this, and that is axial extension, right? So you may have heard that term, and we just referring to basically like from pelvic floor lifting to the crown of the head. So as though you're trying to lengthen your spine. But you know that, you know, you're not really lengthening the spine. You're activating something inside your body that is trying to pull you in that direction. That is your deep front line. Okay? So you're thinking about elongating the spine. It makes you stand taller. A lot of people notice that, you know, when they first start practicing yoga, that all of a sudden they seem taller. And that's just because they've been practicing this elongation of the spine. Like, I wouldn't say that there's like, well, probably you might be nourishing your intervertebral discs and things like that. So I don't know if there's going to be a measurable change, but you do stand taller. You don't look like you're collapsing. And what's happening? Your energy, you're moving energy upward. That's the difference, not downward. Everything wants to collapse downward. We want to bounce off the earth and rise up, basically. Okay. Yeah, so the deep front line is resisting flexion and extension of the superficial front and back lines, and it's moderating those sideways and rotated things that we do with the lateral lines and the spiral lines, rotated postures or side bending postures. Other thing about these structures we've been looking at, yes, they're postural, so they have to kick on pretty frequently, and they're expected to stay on. But the other thing is that they're involved in the startle reflex, especially the soas and the diaphragm. And, this is where, sometimes the startle reflex kind of gets frozen into the body. I think Lee and I were talking about a student of hers that it looks like that, like his startle reflex seems to really kick on. So, you can change these patterns. They could be very difficult. It depends on what the cause was and how long it's been there. But again, just bringing awareness, working on the opposite action, also learning how to activate and then rest, and activate and then rest. Remember, that's what all muscles should be able to do, is be very active and then rest. Just kind of like a dog. A dog can be like super excited and frisky, and next thing you know, he's passed out on the floor. So, we need, our muscles have to have that range, right, of friskiness to rest. So, and that's something to think about if you're trying to change patterns, especially. The other thing, last time I was talking about how we change patterns in the body, is to hold a position for a long time. So like if you have a strong startle reflex that wants to curl you forward, then you could work on something that's taking you even a little bit in the other direction and hold it for a long time. Just let whatever comes up come up. And when I say a long time, I'm thinking several minutes. So you can press yourself into a slightly challenging position. I'm not talking about full wheel pose or anything here. I'm just talking about maybe even like a supported fish pose or something like that, and just staying with that and staying with perhaps the discomfort till you show your nervous system that you're fine in that position. It's fine. Maybe it's not comfortable, but you're fine. You're safe. You can still breathe. It's fine. You're getting tired. It's okay. I can move through this, So, this is when we're trying to change a pattern. Okay. And so we have broad, dense fascia in this line. Lots of it is fascia. Some of it's muscles. That's why we can activate it. And again, I want to just reinforce, like I have this concept that I use in my classes. This line here through this body is basically showing a plumb line if you were assessing posture. Running through ankle, head of the fibula, greater trochanter, shoulder, center of the crown of the head, even throat here, yeah. So I think of that as sort of lining up the bubbles, like if you work with a level tool, right, a leveling tool, if you know that when the bubble is in the center, then it's level, right? So you want to think about arches of the feet, pelvic floor, diaphragm, throat, crown of the head, everything, those bubbles lining up, all those domes and arches, etc., lining up. So that's a concept that I find useful. And again, it's that activating upward. Press into your feet and rise up from there. Direct the energy upward through your body. Again, with practice, this literally will change the orientation of your body tissues. So, depending on who you're working with, a lot of you, it turns out that a lot of you in this course are working with seniors. But I think our demographic in the yoga world is getting older too. So we're encountering that. Could you pass me a tissue? Thank you. So, we're all going to have to know how to work with that. And I think for them, I watch elders, they kind of collapse in on themselves when you want to help keep them rising up, help keep them using the ground under their feet to help elevate them. So, just important concepts to pass on if you can. All right, so so common dysfunctions, of course, with the deep front line is basically collapsing, right? It's collapsing in on itself. So if you were to think about like collapsing through the thorax, we looked at head forward posture, we would see that you're not going to have good diaphragm function if you're collapsing forward, right? And if you're pelvis is dumping forward or it's tilted to one side or whatever, that's going to affect your pelvic floor function, especially for women. If they get too anteriorly tilted with the pelvis, it makes it hard to activate the pelvic floor. So that's a consideration. Here you can see the arch dropping and the knee wants to fall in and might even rotate. So I thought this was a pretty good image, but I'll tell you where this image is from. It's from somebody selling foot orthotics. And so they're showing over here, well, the solution to arches dropping and inner body collapse is orthotics. So it might actually get you here, maybe, but it hasn't strengthened anything. Right? You haven't broken patterns and you haven't strengthened anything. So it might be relieving temporarily, but you would have to wear orthotics all the time. Now you're making your body dependent on something outside of itself, right? So it's really interesting, right? How that's even reflected in our spiritual development, right? In yoga, we're learning to, that we have all of these resources within ourselves. We have the truth and discernment within ourselves. And we're attempting to be less reliant on external things, external sort of crutches, because we want to develop inner strength. And so I would say you develop an inner strength through your deep front line rather than relying on something to sort of prop you up, because you're not getting stronger while something is propping you up. And, I think that is spiritual life right there. It's like dealing with the stresses and the things that come your way and overcoming. So, but I'm not going to give you a lecture about that right now. All right. So yeah, we see all kinds of low back issues, breathing issues, head forward posture. All of these point toward this sort of inner stability is collapsing. And then it ends up in a kind of a depressed emotional state, right? When we looked at interoception, we saw how strongly our emotional well-being is affected by our body postures and the kind of positions we go into frequently, and if we don't move around enough, because our interoceptors are positively affected by even busy work, just moving around your house or, walking here to there and things like that. Moving around is actually much happier energy in your body than just sitting still for hours at a time. Just a good thing to know and pretty easy to implement into your life. Taking lots of movement breaks, etc. So yeah, so I'm advocating for developing your inner stability, but robotic exoskeletons are here. I just looked into this and I was just shocked at how many devices are being made. So we never have to stand up for ourselves. We can get a machine to prop us up. And think about it, you guys. Can external supports make up for a squishy center, right? It's not going to teach your own structures to turn on. Our body is just so intelligently designed and it's so resilient, and it just craves the right stimulus. So, core integrity is partly about muscle and bone and fascia, but it's also a mental state, right? It's a mental, emotional state. It's sort of a state of confidence, so there's an energetic quality to this inner core stability, and they give each other energy. Your tissues give your energy body energy, and your energy body gives your tissues energy. And we could ask, what is the human body really, right? Because we have qualities that are over and above what we express physically, way more than that. So it's my opinion, you might really like these. These are pretty sexy, hey, these exoskeleton. But for me, I'd rather have a natural human body. It gives me more movement options. We can have much more fun and connects, right, with our spiritual and the other non-physical dimension of ourselves. Movement options. Yeah. So if we have goals with working with the deep front line, I would say, create that axial extension, that sensation of lifting through the crown of the head, lift through the heart. Again, that makes your interoceptors happier. And then develop that foot to core connection. As I was talking about, organize and activate, wake up those deep front line structures, really intentionally working with them. You can put blocks between your thighs or your lower legs, do some toe raises. There's lots of things. I've had conversations with some of you in the comments and stuff in the course about, different things like that. And you'll see that in the experiential exercise for the deep front line. So there's lots of sort of little drills to try and things like that to really wake this up. But I just think this is just incredibly important thing to work on with our students, because it does help maintain their ability to continue walking and to have confidence in their body and to have a better outlook on life. So many things. Okay. So we need to know how to strengthen, and we need to know how to calm down, so that's part of working with this line. You want to work through that full spectrum. And just remember, you're working with superficial front line and back line and all these other lines, which are more about dynamic movement, perhaps stability as well, of course, but they're sort of moving the limbs around, moving your legs around. And you're relying on this inner base of support to support all of that more dynamic movement. So what I would say, on a practical basis, you're organizing and activating, feet parallel, press down, dial it out, and really activate through the legs from foot to core, and then draw upward. So you can kind of two-part it. When you're teaching organization and activation to students, you might want to just for a few weeks work with organization and activation, just get them to turn on their lateral and spiral lines until they're really feeling that, and in various postures, and then start drawing their attention to working with arches of the feet, inseams of the legs, whenever they seem ready for that. Because, that is not, you turn that on once you organize and activate. So you really need to, have organization and activation down, and then you're really going to have an easy time to find that arch of the foot, inseam of the leg, pelvic floor, lower belly, and on up the chain of the body. Okay. And, again, we want to draw our energy and intention upwards. So you can see in this posture where I'm just sort of collapsing, I can't really hyperextend my knees, but they're locked back. That makes my pelvis want to dump forward, which makes my upper back want to correct back. And now I have to hold my chin in really strongly because that also wants to bring my head forward. So I probably could have dropped my head forward, but this is such a wretched position to go into that this is the best I could do. But this energy, you can see, the pelvis wants to dump down. The thighs are pressing down. It's a downward, it's pulling the energy downward. Whereas this, where I'm organized and activated, I'm bouncing off the floor. I'm drawing my energy upward through my body. This is really easy to feel once you've had a little practice with it. And then when you go into a challenging position, you can do the same thing. You can press down, not with the head, but with the hands and forearms, and draw the energy upward through your headstand. So it doesn't feel like you're pressing your upper body into the ground on headstand. You're bouncing off the ground and pulling the energy upward. So it really feels different inside. It may not look that different on the outside. This is why I say, it's how the posture feels. If you can feel the organization and activation, and you can feel where you're pulling your energy, direct your energy, we can do this. And it feels entirely different than just trying to sort of suffer in certain postures. So really what we're talking about here is if we're going to challenge the deep front line, we need that strong foot to core connection, right? So some postures to practice that are like toe standing postures. And when I toe stand, it's pressing the toes into the ground and rising out of the bottom a little bit. So that way you really have to turn your legs on. You're turning your pelvic floor and lower belly on. And then something like this where you really have to use your inner base of support to press those hips back, and then foot to core connection. Here, strong foot to core connection. I'm grabbing my great toe. This is, yoga is one of the few activities where you see a lot of great toe grabbing, but it's brilliant because it really helps connect the foot to the core of the body. And this posture is very much connecting the foot to the core. It's very, that's where the challenge is in that posture. So I used all pictures of myself because it's so hard to find the right image, you guys. It's so hard. It takes me hours and hours. I'm just like, okay, I have these pictures. I'm just going to use them. Yeah, so this is how you contain the front body, right? I talked about that with superficial front line. Deep front line is helping with that as well. So anytime, you go upside down or you go in opposition to that downward pull, even in something like this, the energy is lifting upward. This is constantly using the deep front line to create stability in the middle of the posture. And in martial arts, they talk about make the body one piece. And I feel like that's what we're doing. In these full body yoga postures, we're making the body one piece. And it's through this foot to core and hand to core connection, make the body one piece. And then remember, like I've been saying, you want to balance effort with ease, stress with rest, movement with stillness. Okay, we want the full spectrum. We don't want to narrow our field. So this is the only thing we're comfortable doing. We want to be able to go here and here. And so that's part of the practice. Your inner receptors, your interoceptors, interpret your body posture and movement frequency through emotional centers in the brain. And so what you do in your body directly influences your emotional state. And, if your energy is down, so I'm just suggesting a few ways to respond. Like if your energy's down, maybe movement will help. Like if you've been sitting, like this is me, if I'm sitting at my computer for a few hours, I might feel really tired and whatnot, but what I need is movement. I don't need more sitting, so get up and move, take a movement break. But if you've been moving a lot, if you've been practicing and walking and busy doing things, then the balance would be to take a rest. Or if you're having difficulty concentrating, right? Check your posture. Maybe you're not getting adequate oxygen because you're, collapsing forward, bring some extension into the spine and check your breath. And then, if you're feeling like down, emotionally down, then take a walk with your heart lifted and really breathe. Remember, like those body positions really influence your emotional state. So, do these little things to help yourself. They're all within your reach, and anybody's reach. You don't have to be in a yoga class to do them, but just, this awareness. Many of you tell me how, you're encouraging your students to take these concepts into their daily life. And I think that is absolutely essential. We don't want good movement practice to be relegated to the time that we have in yoga class. We want to bring that into our life and learn things, practical things in the yoga practice that we can implement into our life quite easily. And things like, movement breaks, just taking good walks, lifting the heart, these kinds of things are not hard to implement. And especially if you're feeling like a, good response from that, then, you have the encouragement you need to keep going. So that's kind of what I wanted to talk about with the deep front line. Open now for questions if anybody has any.
Karen had a question like a while back. But
Okay.
We wanted to hold it till here. She was mentioning I had a radical hysterectomy 2 years ago with a large vertical incision from near diaphragm to pubic bone. I would welcome your views on how this has affected my deep front line and any specific measures I should take when activating this fascial line.
What I would recommend, so I don't know if everybody heard that, but we're talking about a very large vertical incision from pubic bone to basically lower ribs, so xiphoid process kind of thing. Were any structures cut, like any part of the diaphragm, or was it mainly through the abdominal aponeurosis, I guess?
Hi, it was a very large cut.
Yes.
And it was a deep cut.
Yeah.
But no, the diaphragm wasn't cut. but obviously it was a hysterectomy, so
Yeah.
it was removal of all the internal organs. So
Yeah.
it's quite a big process, and
Yeah.
partly the reason of coming and doing your course is looking at sort of fascial lines and trying to strengthen my body in a better way than I've been doing previously.
Yeah.
Because there's absolutely no guidance whatsoever. It's basically stop exercising.
Yeah,
you
yeah,
know, you
yeah,
can't
yeah.
do anything. It's not very helpful, really. So yeah, I'm just interested to see, because I'm really into it regenerate itself.
Yes.
And you can build your body going forward. It's not just you've got to deal with what you've got at the moment. You can improve things. So
Yeah.
I mean, I don't have any problems with pelvic floor or anything like that, but I've got some of the injuries coming through. So from like back spasm and things like that. So I need to focus on my core. So
Yes, yeah.
and the central line. So any help you
I
can give
wouldn't,
me?
I wouldn't say anything different than what we're doing. Like you're going to activate your deep front line the same as anybody else. You're going to work on the superficial front line as well. That's going to be very important for you. But the one thing that I would encourage anybody to do this, but for you especially, is to get in there with your hands. Like massage all of your structures with your hands. So you would have to do this like in a resting position, obviously, but with your knees bent and feet planted. So your belly tissues are soft. I would put lotion on my hands and I would work all along the rib cage. You want to see how deep into your abdomen you can get. So if you can be soft enough, you could probably rub onto your psoas and your spine. You're going to feel your abdominal aorta, right? Boom, boom. So I would go in, because you're probably, especially through that central line, you're going to have healed connective tissues, which will feel kind of ridgy and not as soft as the surrounding tissue and stuff, right? So you want to mobilize that. You want to move that around. You want to make sure everything can slide. Anything you might have structure stuck to it, where that was healed. So you just want to make sure things can move and slide. And it's also going to be maybe at first you'll feel a little anxious, but then it's going to really calm your nervous system. When you work on your abdomen with your hands, it's very calming to the nervous system, but you might have a little squeamishness to get over at first. So if you're willing, I'm telling you, this is really profound work, Karen, and you'll really get to know your abdominal cavity, and then, I don't want to go into therapy here, but I would, just really talk to your body, because it's a big trauma and your body's missing that tissue, So just be, hands are incredibly healing, your own hands on your own body. Get to know that abdominal cavity and all your structures and keep them soft and slippery. And that's the only thing I would add for you. Otherwise, you want to learn how to turn them on and, be really generous and gentle with yourself because you have to go really subtle. It's, it's still the order of progression. It's still progressive overload, but it's subtle and it's just a sort of a next level. I think you'll really appreciate the interoceptive practice when you get there. So there'll be some healing for you, and I would love to hear any updates about that. That would be great. Okay, I hope that helps.
Thanks.
Yeah. Okay, go for it, Donna.